Good afternoon, audience. My name is Aaron, and today we'll be informing you about biological prepardness here are my fellow constituents.
Gordon, Hamad, and Trey.
To begin, the United States, one of the world's greatest superpowers, is full of citizens, as well as legislators that possess a fatuous, esoteric belief that due to our position of power, international influence, and Class A technology, that we are impervious, even godlike. Yet we are so ignorant to an unsettled truth, even the mightiest of civilizations would fall. The Incan Empire was the largest and most advanced South America had ever seen. Yet for European intervention and the spread of old world diseases, it was eradicated. Even in this modern age, we must remember that history can repeat itself, no matter how prosperous the civilization. Which brings us to the question of how prepared the U.S. government is in responding to, as well as spreading awareness of possible biological attack. The U.S. over time has set up a plethora of methods in order to counter a biological attack. Leading agencies like the Centers for Disease Control Prevention, as well as the American Public Health Association, have personnel working incessantly to protect the civilian active vulnerability from the harmful use of biochemical agents like anthrax and H1N1. Yet on a 2011 report card, the U.S. was rated C's, E's, and F's on biological preparedness for a large-scale outbreak by regular arson. National Security Advisor, University of Pittsburgh Medical Center. Also saying that not much has changed since then. Current legislation in our nation lacks in effectively informing our public in the event of a biological outbreak. This trend consequently affects our local health responders who work with outdated medical information. Not only these factors, but others collectively contribute to our nation's weakness towards biological preparedness.
So, as kind of an experiment with the audience, I would like to see a raise of hands to these types of stimulus, just to see how much you know. So, in the event of a hurricane, would you guys know what to do? Just by raising your hand. How about a tornado? An earthquake? How about a biological attack?
Now, the United States government has enacted several bills that contain preventative measures against a possible biological attack. In 2002, President George Bush signed the Bioterrorism Act. This bill consisted of detecting harmful biochemicals through food inspection, efficiently expediting treatments across the country, reinforcing communication networks between healthcare providers and public health authorities, and developing better medicines for the future. President Bush also created Project BioShield in 2004. We established the Department of Homeland Security, which better secured our ports and borders, and the National Stockpile, which houses millions of medical supplies, vaccines, and medicine in case of an emergency. Even as far back as 1989, President Harold Bush enacted the Biological Weapons Anti-Terrorism Act, which basically created laws that prohibit any conduct related to the creation or distribution of biological weapons. These legislations obviously have numerous developed protocols that may make it seem as though the government can prevent any biological attack. However, they only miss one pivotal component. All these bills lack methods of informing the public. Clearly, there's a lack of communication between government and American citizens, as evident by the survey we just conducted. A majority of you knew what to do in the event of a tornado or a hurricane or earthquake, but only a few of you knew what to do in a biological attack. Therefore, the government needs to spread awareness of biopreparedness, as they can stop a large catastrophe from becoming even bigger.
To build off what Hamad said, there's a clear lack of communication between federal agencies and the American public. But this communication also extends into our local health responders, such as nurses and paramedics. The Institute of Medicine Forum on Emerging Infections said that a strong public health system is key in biological defense. But that doesn't seem to be the case with our local health responders. According to Christina Wong's article on Could U.S. Handle Biological Attack, she mentioned how 2 nurses at Texas Health Presbyterian Hospital were infected with the Ebola virus, most likely due to the lack of up-to-date medical information to protect themselves and their patients from this disease. Hamad had also addressed the Bioterrorism Act of 2002, stating how it was supposed to reinforce communication between local health authorities and federal agencies. But Robert Gary, microbiology professor at Tulane University, discussed that there's still gaps in communication, especially among medical information on diseases such as Ebola and others, and that most healthcare facilities in the U.S. are still lacking up-to-date medical information to protect themselves and the communities in which they reside.
Now, not only are there flaws in communications and the transmission of biopreparedness strategies, the entire system of biopreparedness programs are rife for pitfalls that hinder success. Now, from the CDC Justification of Estimates report for the 2014 fiscal year, it is seen that the total amount of funding for the state and local preparedness and response capability, CDC preparedness and response capability, and their strategic national stockpile was totaled at $1.33 billion. This constant use of money just for preparation strains all other sectors of the U.S., especially education, utilities, and many others that help us function. In addition to that, major vaccine manufacturers produce massive amounts of vials and immunizations with little effectiveness in how much is used and how it affects the patient. An article from the American Journal of Public Health by Gould, Cohen, and Victor Seidel stated that many of the world's most prominent public world health organizations, like the World Health Organization and the CDC, were opposed to producing millions of vaccines for a smallpox outbreak in the early 2000s due to the very dangerous adverse side effects of the immunization. And from that occurrence of smallpox outbreak, the government made millions of vaccines in which most of these wouldn't even be used, resulting in adverse effects for the patient and a waste of resources. In order to protect the public from these biochemical weapons, the government must also possess chemical agents in order to understand them more. But the presence of these agents assures the possibility of accidental exposure or malicious release of the biochemical agent to the public. Amidst all of these pitfalls in our infrastructure, we need to reevaluate our system and create plausible solutions to better develop biopreparedness programs.
Now, it goes without saying that the United States needs to refine its biopreparedness agenda. Therefore, our group formed a solution called BPN, or Better Prepared Nation, based on a plan created by the National Environmental Health Association. Their plan included things such as developing procedures for home-based patient care, and making use of local spokespersons and first responders to disseminate information and receive aid in the area affected by the biological attack.
So the first link to our plan is Biodefense, the New Age pamphlet. This informative pamphlet can be distributed to American citizens through like mail services such as UPS and United Postal Service. And this pamphlet will contain important information such as the different levels of lethality of different types of biological agents and ways to prevent yourself from them. It also contains information on the different things you can do in your community to create either stock up on canned foods or create shelters with ventilation to survive in the event of a biological attack. Yet a factor we have to consider is that the U.S. being the diverse nation it is, these pamphlets would need to be printed in different languages to reach the wide majority of American citizens.
Continuing off of what Martin said, we shall address the issue of misinformed local health responders through Project Outreach, which is our plan on redistributing funds to local health facilities by the government allocating small funds to set local health facilities every 3 to 4 years to ensure that the local health responders have up-to-date information and training. Yet one factor must be taken into account. Individual states have different policies on how they spend money, especially towards healthcare, so the government has no real control over where that money goes.
And the last leg of our plan is the National Biodefense Conference. Now, this is a summit where delegates from across the nation meet to discuss matters of funding programs, medical and information method distribution, and identification of biochemical weaponry. Now, the only drawback of this would be scheduling issues to get all important delegates to the summit at one time. And that can be subsided with multiple dates and extension of the summit. Now, through the evaluation of the different facets of biological preparedness, it is seen that the U.S. isn't prepared to meet the challenge of a biological attack. The lack of communication, a procedure to health responders and the public, ineffective legislation, and a weak and flawed infrastructural system have brought us to a low point in our process. But as Sean Combs said, everyone has challenges and lessons to learn. We wouldn't be who we are without them. We as a nation must learn from our mistakes, and from there, combat this local threat. With a refocusing on local response systems, new mediums of information circulation, reform funding projects, and a constructive platform to further our ideas and understanding, we as a nation will be ready to combat any biological attack and will ensure safety for the American people now and for the future as well. Thank you.
Thank you, guys. You mentioned BPN, and you said you got that from somebody else or whatever. Was BPN, like that acronym, something you guys came up with, or is that other, or is that you got that from a source and then incorporated that into what you said?
We used the National Environment Health Association as a framework to establish our own plan. That was BPN. And
But
so,
BPN, you made up that acronym?
Yeah, we made it.
Good job. Which of your resources ended up being the most helpful and why?
I think that our most helpful resource would probably be the CDC because they contain a lot of information about biological attacks. They gave a whole list of over 20 biological diseases and strains of viruses that can be used as a biological weapon. And it gives a lot of information on more statistics, more in-depth information about processes and a lot of things going on in the biological preparedness world and what the U.S. is doing right now.
Are you saying CDC?
Yes, CDC.
Like the Civic, what is
Center for
it? Disease Control. Yeah, right.
Prevention.
Thank you. How valid and reliable, outside of that source, how valid and reliable would you say the sources were that you used? Because that one is reliable. There's no question about that.
Well, we use sources from doctors, we also use CDC. So I think, well, most of our sources, we made sure that they were cited well, and they were reliable. So I say for the most part, most of our sources were reliable. As they showed like where they came from, which universities, like Tulane University, and like which doctors and exactly what worked or what they said.
Can I continue off of what Ahmad said? Just a little?
Sure.
I just wanted to add that among those doctors, like we even got some of them that were actually on the inside, like they work for the CDC or the American Public Health Association.
Okay, that's one you hadn't said. How'd you handle the differing perspectives of each other as you went through this process?
Even when we were writing the blue paper or just planning on for this presentation, we really made sure that our writing styles flowed and connected and such.
Were you did you have differing opinions? No, that's not Mark.
Well, we found some of our sources were the same and some of our ideas were the same, but I felt like we all had our own ideas and we all incorporated together to make a really good paper.
Let Aaron answer that question, if you would.
Okay.
Let Aaron answer that question, if you would. You already answered the question, Martin.
But
Yeah, like, did you individually have differing opinions, and how did that work as you went through this process?
oh, well, in my opinion, at first, before we did any of the research and such, I thought the U.S. was almost completely prepared in case of any sort of small-scale or large-scale biological outbreak.
And how do you feel now?
Oh, shoot.
All right, thank you, guys. That's good. Thank you.